legally, if the needle towards the left shoulder in about a 30-degree angle. And you just kind of put the needle in and you start to aspirate, which means pull back on the plunger as you're kind of advancing the needle. And you want to advance that very slowly, not like the Vincent Vega approach, but and just kind of pull back and just start removing that fluid. And as you do that, then the patient's blood pressure should improve. They should start to become more awake. They may jump up out of their skin like Uma Thurman did and say, "Whoa, what was that?" No. So next slide.
Kip, you say the sub-xiphoid approach. I mean, I know what that means, but what for the other guys? What does that mean?
Yeah. Asking for a friend. Yes, the
lifeline on that one.
The little tip of the sternum. You see that little thing hanging on there?
Yeah,
that's like a tail.
Yeah, that's the xiphoid process. So sub would be below that. So if you look at that little black dot just to the right, yeah, that would be the one. Yes, that would be the one you want to go and angle that towards the patient's shoulder at a 30-degree angle.
So can you feel that little?
Yeah.
Okay.
I can feel it.
Yeah. Okay. Everybody, start feeling your xiphoid.
You're making me sick.
Yeah, go down your sternum, and then you can feel that little tip right there. You feel it?
Yeah.
Oh yeah, there it is.
Yeah.
Kill.
This is the best ever.
When you do a Heimlich maneuver, aren't you supposed to put your hands there?
That's actually good. That's great, Dave. That is actually right where you want to be. Just below that is called the xiphoid, and that's where you would press on a Heimlich.
Suck it, Griffin. Oh shit!
And why would he say that?
What'd they do to that dude?
Yeah.
They cut his head off.
Yeah,
he's got more problems than just his heart issue.
Yeah, I think the pericardiocentesis is a little late.
Your head falls off if you don't get it done.
Yeah,
I think the top was the Molly hatchet, right?
This is in Chris's cabin.
Yeah, I don't think the procedure will help this guy at all.
At least it'll give us experience, though.
Yeah, it gives you good landmarks there with some actual anatomy there. Next slide. And just as we talked about earlier, just kind of advance the needle in, start aspirating.
We have to wear a suit?
So clearly, this guy is not a doctor.
His hand looks as fake as the doll does.
This is how they do it in Morocco.
Got some weird wrinkles.
Kip, how far do you push it in there? Do you feel like a resistance or?
Well, that's like I said, as you advance the needle, you're going to aspirate. So you're going to keep going in until you hit blood or oil or,
Beer.
Or beer.
Okay.
His nipples are weird. That's all I can say.
Stop when the L starts coming.
It's kind of weird that the goal is that when you start to see blood, I feel like you're going to get that anyway, whether you hit your mark or not.
Yeah, and that's a good question too, because you want to take that fluid out of that pericardial sac, which is probably going to be bloody, most likely. And then if you go into the heart, actually penetrate into the heart itself, obviously you're going to get blood as well.
Yeah.
So are we talking like an ounce? Are we talking 2 ounces? Is it like
it depends on how much is in there. But and you take out as much as you need to help let that heart pump again effectively. So it could be that whole syringe full, or it could be just a little bit, maybe half of it.
Yeah.
And if there's a lot of fluid in there, what you would do with that needle is you actually leave that, there's like a catheter over top the needle, you would leave that in place, and then you could just continue to drain it periodically, put like a little stopcock on it. And then sometimes what a cardiothoracic surgeon would do is called a pericardial window. So if that fluid is going to just continue to reaccumulate over and over again, they'll just make a little incision and make a little opening and open up that cardiac sac. So it'll just, instead of building up in that sac every time, it'll just kind of leak out and won't cause any tamponade. And then next slide, after the procedure, just pray that you don't get sued. And then you can get, test the fluid. Next slide.
Don't do a video that might show up on a hockey podcast.
Oh, that's good. Yeah, the risk and complications. So you could kill them, cardiac arrest.
So will all of these bullet points lead to death?
Pretty much. MI, heart attacks. Sometimes you stick that needle into the muscle, you can put the heart into an abnormal rhythm, ventricular tachycardia. You could lacerate the heart muscle. So obviously you can do some pretty good damage that. You can puncture a coronary artery. Other organs, you could put it in the wrong spot, maybe aspirate the liver, stomach.
If you go 30 degrees the wrong way from that little pointy thing,
Yeah.
it's a problem.
Pretty sensitive in there, eh?
Yeah. And you could damage the lung as well. So next slide. Tips. All right. This pretty much says right here, don't do this on your friend. There's nothing in here that says do this on your friend. And that's it. I think we also have a video, don't we?
I don't have the video.
Oh, okay.
Jack, can you go back? Jack.
Oh shit. All right. Wait, hold on a second.
I'm sorry. There was a bullet point a couple back that struck me. The next one back. Pericardial tamponade often results in sudden cardiac arrest. So be prepared to immediately apply this therapy when indicated. What does that mean, Kim?
So when someone's having the pericardial tamponade and their heart's not going to pump real well, they're going to probably go into cardiac arrest. So if you have somebody that comes in that's in a cardiac arrest, and let's say they have Beck's triad, and you're not sure why they're in cardiac arrest, so sometimes we'll stick a needle into the chest just to see if there's any fluid. Now, obviously, we have capability now with having bedside ultrasound in the ERs. Many years ago, we didn't have the bedside ultrasound, so you can put this ultrasound probe on there and actually see that they have a tamponade, and then you can do solve it. If you don't have the ultrasound available, you could actually just take a needle and just, if you suspect it, you could put the needle in there and just try to aspirate any fluid, see what happens.
How often have you had to do this procedure?
I've done this one twice.
How often do you think,
Not very
how often
common.
do you think we have to do it?
Well,
In Canada.
we do drink a lot of beer, so we may have to suck some beer out.
Keep going to the oil.
Yeah. All right. We'll maybe we'll have to show the video.
No, we're getting there. Hold on a second. Just
Okay.
Kip, is this something you do in the ER, or is this something you do in the field? Something if you had to do in the field somewhere?
Yeah. So typically, you're probably going to do it in the ER. Most ER physicians are trained in the procedure. The EMS paramedics and stuff, they're not actually trained in that procedure, so they probably would not be doing it in the field.
all right. Let's see what we have here, Kip.
Here's a video that demonstrates the procedure.
Oh,
Now,
That's the ultrasound probe there.
one thing I want to point out here is that this is done in the cardiac cath lab most often, but just because it's done in the cardiac cath lab doesn't mean that we use x-ray. There are some procedures done in the cath lab that, the x-ray machine isn't used. And so a lot of times this is done under ultrasound guidance. And so this could be done at the bedside, if the ultrasound machine were taken to the bed. But a lot of times it's just done in the cath lab just because that's what's familiar, that, we've got the table, we've already got the sterile drapes that you need, the chloroprep, all of the prep. And also then the scrub assistant is already there. I mean, everything's just all set up already. So a lot of times they're done in the cath lab, but do understand that this is done with ultrasound guidance. So anyway, it's showing the needle just going in. Of course, the skin has been cleaned and prepped here. The needle's going in. And
So do we pour beer or whiskey on the skin? Because when we're going to do this?
It would be a
Clean it.
great sanitizer.
Okay.
Yep.
Yes, especially that 14% beer that Glenn is drinking.
Yeah.
Glenn's not going to want to waste it though.
then once
Yeah.
the needle is in place, they put a syringe on it and start pulling back. This is kind
Oh,
of this is like
on the
an,
inside.
Nice.
so this is the heart, and it's getting ready to see that there's
Oh.
just covering the thorax. But then
Just-
this is below. That's the heart.
Holy shit.
Holy shit.
That's
You're
a good
close.
video.
Is this the video you meant?
Okay, so
No, but this is a good one.
Is that his belly button?
and
No,
No.
if it is, you're in the wrong place.
This is what you're talking about. It's going to be bloody, but it's not going to be blood, right?
It's like pinkish. Yeah.
Yeah.
and that is a pericardiocentesis.
It looks like a sour, like a raspberry sour.
Exactly. A raspberry sour it's one of Tommy's best.
Good point.
Kip,
Yeah.
the 2 times you had to do this, was someone in like life or death situation?
Yeah, the one I recall the most, there were, and it sometimes can happen in dialysis patients. They get renal failure and they get uremic, and this one was in a cardiac arrest up on the floor that I went to. I think it was in residency, and so we decided to do pericardiocentesis because we suspected that's what it was. Took the fluid off, and she actually got a heartbeat back. I don't recall that she had other issues that she probably succumbed from, but we were able to actually get the heart to beat again, which was good.
Were you shitting yourself when you had to do this procedure?
It's kind of, you get some good sphincter tone there, and
Sphincter tone.
it's one of those things you don't think about it, you just kind of do it, and
So when we do it, we shouldn't just don't think about it, just go
Yeah.
for it.
just
Don't
go
be
for it.
nervous.
You've had your training. You guys are good. You're solid. Just do it.
Now, Kip, you alluded to after Dave's question that this is more about missionary, but to me, it felt like that video was more of cowgirl classic. Is that, yeah.
Yes.
So I guess it's curious.
Yeah. In any
Look that up.
procedure that you learn, the mantra for when you're training as a physician is you see one, you do one, and you teach one. So you guys have seen one. Now it's time to do one, and then you'll teach one.
All right. Excellent.
Nice.
Excellent work again, Dr. Hogg.
Anytime.